Welcome to this session titled Supporting Indigenous Communities and Partners to Access Their Data at ICES. Next slide, please. My name is Sajitha Ratnasingham, and while we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the lands we are on. I live in Toronto with my husband and two sons. I'm a settler to this land with ancestry in South Asia. I want to take a moment to acknowledge the land I am on as the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and Wendat peoples. It is also home to many First Nations, Inuit, and Métis peoples. This land is covered by Treaty 13 with the Mississaugas of the Credit. We are thankful to be able to work and live in these territories. At ICS, I'm the Director of Strategic Partnerships and the Interim Director of the Indigenous Partnerships Data and Analytics Department. I will now pass it on to my colleague, Jessica Jordeo. Next slide, please.
Hi, everyone. My name is Jessica Jordeo. My pronouns are she and her. I come from a settler background. My parents immigrated from Portugal. I am a mother. I have a 4-year-old son and a 1.5-year-old daughter. And I live with my family in Aurora, Ontario. One thing that we really enjoy doing together as a family is exploring different trails in the area with our German Shepherd named Whiskey. So I have a couple of pictures here of her excursions. I know that Sujitha has already done a land acknowledgement for this session, but I also wanted to note that I'm grateful to all the Indigenous peoples who have been the original caretakers and continue to be protectors of this land where my family lives and plays. In my role as a Senior Research Project Manager for the Indigenous Partnerships Data and Analytics Department at ICES, I help support Indigenous research projects and initiatives such as the ICES Indigenous Health Data Training Program. And now I will pass it to my colleague, Graham McCready.
Thanks, Jess. So my name is Graham McCready. I'm from a settler background as well. I'm a fifth generation Canadian of Irish descent, born and raised in Kingston, Ontario, and I live now here in Toronto. As you can see, I think me and Jess were on the same page with our pictures here, where it looks like we both do a lot of outdoor dog-related time. You'll notice there's no little kids running around in mine as of yet. So at ICS, I'm a staff scientist within the Indigenous department. I've been at ICS just over 11 years. And in my role here now, I work with a wide variety of Indigenous partners and work on projects with them. So happy to be here. And we're going to move on to the next thing, which is a couple of poll questions. So throughout the session today, we have a couple of questions that we're going to ask. So we have a few up front here just to get people primed and ready to answer. So you'll see that they've popped up on the screen there. The first one is just asking, how are you feeling today? Very simple. Could be feeling good, could be feeling okay, medium, could need some more coffee. You know, coffee is usually a big hit in this question, so not surprised to see some answers there. So far, fantastic in coffee. We like that. I'm going to scroll down and have a look at number 2. This one is, you know, it can be very divisive, whether you like pineapple on pizza or whether it belongs on pizza at all in the first place. This one can, I think friendships have been lost over this one, so it's very serious. So far, I'm definitely in team, yes, definitely. Those flavors are phenomenal together, but you know, to each their own for sure. So it looks like we've got a good number of answers for that. And then finally, we just wanted to get a sense of where people are coming from today to this presentation. So this question asks about who you're employed by, just to give us a little bit of sense of who we're presenting to and so we can sort of try and tailor the information and the answers to our questions as best we can. So it looks like we have a pretty good spread of people coming from different backgrounds and different types of organizations. So I think that's great. All right, well, thanks to everyone for participating in that. The other thing we wanted to note right up front is that we really do, it's a very cliche, and you've probably heard this all the time, but we want this presentation to be interactive. We want to really give space for people to ask questions, and we're here really to answer questions. We have a presentation that we'll go through, but really we're here to answer questions that people have about the work we do, or the types of data we have, or the types of partnerships that we built. So there's a couple different ways to ask questions. In the chat, which is available sort of on the right-hand side for everyone on your screen there, you're welcome to post a question right in the chat that is visible to everyone, and we can answer them in that way. If you'd like to ask a question that is anonymous, just above where you type your chat question, there's a little box that says to, and you can click on that. And instead of posting it to everyone, you can send it directly to the account titled admin-questions. And then they will post those for us to see. So if you'd like to have your question a little bit more anonymous, you can post it to admin-questions, and we will answer all of those either as we go through the presentation. We can answer some now, we can answer some at the end. Whenever they come up, feel free to type them in, and we can answer them as we go. So we'll just give everyone a moment to get oriented to that. If there's any questions about how to ask a question to admin-chat, you can post that to everyone, and maybe more than one person is having that question as well. So yeah, that's perfect. That option will be there available. So let's continue on, and we'll get started with the presentation. I'll pass it back to Sujitha.
Thanks so much, Graham. So as Graham said, feel free to pop your questions in throughout the presentation. We'll try to pause and answer as we go along. So those of you that may not be as familiar with ICS, our vision as a not-for-profit research institute is to improve health and healthcare for everyone through world-leading research and analytics. And we do this through 5 success factors: data leadership and services, and this includes bringing together lots of different types of data increasingly, and strategic partnerships, public and community engagement, organizational excellence, and research and analytics impact. Next slide, please. Because we do hold a lot of data about people that live in Ontario, we take privacy and security very seriously, and we have many measures that we use to protect the information that has been entrusted to us. Things like technological safeguards, as well as physical measures to control access to specific rooms and locations. Now, in addition to that, we have a very robust policy and procedure infrastructure that are reviewed every 3 years by the Information Privacy Commissioner of Ontario. And that's part of the reason we're able to hold this data. Now, one of the examples I always like to point out, because we receive data that has people's information, identifying information, before researchers can access it, that information is removed. The only individuals that see that are a select, highly trained group of individuals that use that information to code that data set, and then they remove the directly identifying information. Next slide, please. Oh, sorry. Thank you. ICS has been working with Indigenous partners and communities for over a decade, and in doing so, we use 3 guiding principles as a basis for this work. First, we will support Indigenous-driven use of ICS data. We will aim to be a trusted partner for Indigenous organizations, scholars, and communities in their use of data to promote well-being, healing, and effective policy. And finally, we will listen to and learn from Indigenous teachings and principles so that we can strive to apply them to our relationships and collaborative projects. Next slide, please. So now we've come to our next 2 poll questions. The first is just to get a sense of whether your familiarity with research. So have you been part of a research project before? Yes, no, and I think so. Just giving folks a moment to put in their info. So it looks like most people have been part of a research project. So that's really helpful for us in terms of the information we'll share today. And then the next question is, have you worked with ICS before? No, and I'll scroll down. Yes, a bit, and yes, a lot. So I think most people have not directly worked with ICS in the past, and then we're split in the other two. Some have worked a lot, and some a bit. Thank you so much. Next slide, please. And we talked about our guiding principles for the work that we do as a foundation. In addition to that, we have a framework that really kind of gives us a direction in how we do this work with Indigenous data and partners. Now, this framework was initially developed in collaboration with the Chiefs of Ontario for working with First Nations data and First Nations partners. It has since been adopted by ICS for our work with all Indigenous data and partners. So central to this framework and to the work that we do are Indigenous data governance principles. So as you can see, if that piece isn't there, you can't really build out from it to get the 4 quadrants. Now, from the data governance principles, we have 4 areas that we focus on. On the top right, we have data governance. On the bottom right, we have methodology and approaches. The bottom left, we have evidence to build policies and programs. And the top left, we have ethical relationships. And through the rest of the presentation, we're going to walk through these 4 quadrants and talk about how we do this work. Next slide, please. So the first section we're going to speak to is data governance. Next slide, please. Now, those of you that have worked with First Nations, Métis, and Inuit partners and communities are probably familiar with some of these data governance principles. Now, there are different sets of data governance principles used when working with different partners and with different populations. So the OCAP principles, which stand for ownership, control, access, and possession, which was developed by the First Nations Information and Governance Center, is really the grounding for work with First Nations data. Now, the 6 principles of Métis health research are the foundation for the work that MNO or Métis Nation of Ontario does. And then we have the IQ principles for work with Inuit data and Inuit. And this is really based on consensus and how we coexist and work together. Next slide, please. And you have to click it once more, sorry. Thank you. Now, ICS uses formalized data governance agreements to protect the data. In particular, now we're talking about Indigenous data, and minimize potential harm, because ICS really acts as a data steward for Indigenous data. Although we may hold custody of this data, we recognize that the ownership and the voice and control really should not and does not rest with us. So what we've done is we've built these partnerships and data governance agreements to overlay on top of the data sharing agreements that we have with data providers, so that the Indigenous governance always kind of comes into play when we're talking about data, whether or not the data sharing agreement has that formalized within it. So in the First Nation space, we have data governance agreements with the Chiefs of Ontario, Grand Council Treaty 3, and Kenora Chiefs Advisory. And these 3 agreements are distinct, but they're also framed in such a way that they can coexist and do not interfere with each other. In the Métis space, we have a data governance and data sharing agreement with the Métis Nation of Ontario. Next slide, please. Sorry, one more time. Thank you. Now, in addition to the partners that we have data governance agreements with, we also have many other partners that are increasing over time. In the First Nations space, we also work with political organizations, First Nations health authorities, Mamo Yamoen, which is a First Nations alliance of communities in Northern Ontario, and with individual communities. In the Inuit space, we also have worked with Tungasuggat Inuit, Inugatagit Center for Inuit Children, Youth, and Families, who have done a research project with ICS, and a Kasavik Inuit family health team, whom we've been working to find ways that we can support them in identifying their peoples in our data and then be able to support their client healthcare delivery to their clients. And now central to that is a group where they're working with all three populations. So we have partnerships and agreements with Aboriginal Health Access Centres, the Indigenous Primary Health Care Council, and other Indigenous primary healthcare organizations. So we try to make sure that we are open to working with lots of different partners and are responsive to their needs as well. Next slide, please. And I'll turn it over to Jessica.
Thank you, Sujitha. When we talk about how we work with our Indigenous partners, especially as it relates to data, ethical relationships is obviously a key component. Next slide, please. The collaborative work that we do with our partners should always be ethical and respectful and include ongoing communication. We have also implemented processes to support community-led analysis of data and explored different ways to support mutual capacity building. An example of this is we've supported a number of practicum students and secondments. We found that while ICS staff may provide capacity strengthening from an analytical perspective, we also benefit greatly from learning firsthand from our partners, and that really helps us become better partners in these relationships. One other capacity strengthening initiative I wanted to mention is the ICES Indigenous Health Data Training Program. This program was developed to provide learning opportunities for Indigenous communities and organizational members to gain a better understanding of the research process and to provide practical knowledge on things like how to develop a research question, what goes into an analytic plan, and how to interpret and share research outputs. We have run the program through different means. So we've had virtual meetings, we've had in-person meetings, and now we also have some recorded content that is now available for viewers to go through at their own pace at a time that is convenient for them. So if you are interested in the recorded content, you can contact us at indigenous@ices.on.ca. Our contact will also be at the end of the presentation, but you can reach out to us if you're interested in that content. And I also want to mention that in some cases, we've partnered with our partners to create tailored content using practical examples with their own data. So that's something we've also done if you're interested. Next slide. And this brings us to our next poll, which asks, do you think your Indigenous organization or community could benefit from learning more about the research process? So that looks good. We have some interest. Some people who are not, a couple of people who are not quite sure maybe. So that's great. Please get in contact with us if you'd like to learn more about the program. I think we can close that poll. Thank you.
Okay, thanks, Jess. So I think that's over to me. So I'm going to talk a little bit about the methodology and approaches quadrant here. So some things that are comprised in there, we're talking about Indigenous perspectives and models of well-being. We're talking about trying to understand the data gaps and some of the data quality issues that we're working with when we use this type of data. We know there's lots of gaps and there's many issues with the different data sources that we have. So it's so important that we know as much about those as we can, and we can sort of account for those as much as we can when we do work with partners and when we try and explain the results of that work. Relating to that is bringing in additional context to support the numbers. So as you might imagine, people's access to healthcare and experiences with the healthcare system can vary greatly. depending on all sorts of factors, including, even where you are in the province. So that's really like the type of knowledge that the context like is so important, and the type of knowledge that we get from our partners through the process of working on these projects. They're the ones that are on the ground experiencing these things firsthand or working with people who are, and really building that into the research projects or any projects that we're doing is so important. And then finally, in this quadrant, I'll talk a bit about linkage and analytics on the next slide. So when we think about the data sets that we use to conduct an Indigenous co-led project, there's really all sorts of layers that are sort of involved in putting that together. So we have the provincial health services data, so sort of the ICS bread and butter data, things like visits to physicians, hospitals, and emergency departments, all that data for the province. We have Indigenous data sources, which I'll talk a bit about on a further slide, but that comprises, things like registries or self-reported Indigenous status data. And then we have the data governance agreements, which Sajitha touched on before, and all of those sort of things layer together to pull together a data set that we're able to use to conduct research with our Indigenous partners. And when we're doing that research, typically things are done a little bit different than a typical ICS project. So we're thinking about things a little bit differently, and that includes thinking about different types of methodologies and approaches in order to do the analysis. So we have some great resources. There's a couple of them listed on the slide there that we've sort of gone through and looked at. We even have copies of these resources and a whole bunch of other books in our office that people can take out and read as well, whether they're involved in this work directly or just want to learn more about it. So if we move to the next slide, I'm also going to talk a bit about the evidence to build policies and programs quadrant. So the two things that are listed in there are collaborative research projects, as well as service model data requests directly from communities. So that's really something that we focus a lot on, is that work directly with communities, where communities are sort of coming forward and asking questions and wanting to know more about the health and the health service use of their populations. So that's really where a lot of our attention goes. And if we flip to the next slide, there's a couple examples of some of the collaborative research projects that have taken place in the past. All of these projects are very much First Nations focused. But if you saw the session this morning that Sajitha was moderating as well, but about work that's gone on with the Métis Nation of Ontario, that session was specifically related to work during COVID-19, but we have all sorts of ongoing projects with the Métis Nation of Ontario and secondments and staff working with them as well. But for this slide, these are examples of sort of collaborations that have taken place with regards to First Nations research in the past. So these are some big projects that have been put out, looking at things like cancer, diabetes, prescription opioid use. So those were done in conjunction with multiple partners, but including the Chiefs of Ontario. And these reports are all available on our website as well. The mortality study there is a big collaboration between a partner called Mamo Yamwin, which is a whole collection of First Nations communities in the north of Ontario. I think 70 something communities are part of that partnership, and they sort of all came together and did that work together, and then all got copies of overall reports as well as tailored specific reports for their communities as well. And then finally on the side there was a big aging study that was done with a big group of partners as well. So just some examples of the collaborations and the projects that have come out of those collaborations in the past. And I'm going to pass it back to Jess.
Thank you, Graham. So this brings us to how to access data at ICES. If you happen to already know an ICS researcher, and you have some funding, then you'd be able to get access to your data through our main research arm. And it would be guided by that ICS researcher. But if you don't have an ICS researcher that you know of and you're fairly new to working with ICS, then you may want to hear more about the Applied Health Research Question, or ARC program. Sorry, I think there may have been a question that just came through about the previous section. Let me just check. Oh, okay. Graham, maybe you can answer it after I present this piece. Is that okay? Okay. Sorry about that. So the ARC program is a Ontario Ministry of Health funding program to produce research evidence that informs planning, policy, and program development for the benefit of the Ontario health system. The funding program includes dedicated resources for Indigenous communities and organizations, and this can be individual communities, groups of communities, or Indigenous organizations. It should be emphasized that for Indigenous projects, documents and results are not shared with the ministry or others outside of the requester. And another important point to note is that the data is provided at no cost to Indigenous communities or organizations. Next slide, please. Oh, can you also advance it? So that's great, thank you, keep going. This is a simplified depiction of the ARC pathway. If you are interested in conducting an ARC project, the first step would be to have an ARC request form filled out. In more recent years, we've worked to streamline this process for our Indigenous partners. There is a modified ARC request form that is used by Indigenous requesters. And we also can help with filling in that form for you. So we can work with you to fill out the form based on discussions we have with you about the project. So we certainly don't want the form to feel like any kind of an obstacle to making the request. So we're happy to help you with that piece. And then once the form is filled out, we also ensure that we have community and/or organizational leadership support. And this is to ensure that ICS has the appropriate permissions to access the data. After this step, there is an internal ICS review, and this part can take some time, this part of the process. This is where we're doing a lot of paperwork and doing those security checks, but it's important to ensure that we're working in alignment with legislation and with those agreements with our Indigenous partners. So it's an important piece of the process. After the review is complete, then analysis can begin. And then the final step is to share the research results back with the partners. That being said, there is ongoing communication happening throughout this process. We work with our partners to figure out how often they want to have touch points throughout the analysis process in terms of sharing preliminary results and getting feedback in terms of direction. Okay, next slide. I think this is maybe where we'll pause to take some of those questions.
Yeah, that sounds great. So it looks like we had one question come in so far, and it's a good one. So I'll read it out and then I'll answer for everyone. So the question is, how does your research methodology take into consideration Indigenous social determinants of health that include colonial and structural racism, well-being of spiritual and traditional food and medicine use in our communities? So thank you very much for that question. You know, we know that Indigenous people experience different interactions and different experiences with the healthcare system. The healthcare system is a colonial structure. We know that there's institutional racism that people experience in the system, and all these sort of things interact in different ways. Indigenous people have access to healthcare also in various ways that we don't always have the data for at ICS as well, whether that's through NIHB or nursing stations in communities. or even like the question states, even the use of traditional medicine and traditional healers, those types of things aren't necessarily captured in our data. So when we think about sort of how all those things interact together, I think sort of one of the main effects is that we don't see Indigenous people interacting with the healthcare system potentially as much as the general population due to some of those factors. So a lot of times when we're looking at research results, we know what we're looking at is potentially an underestimate of the true need of the populations that we're studying, and the true burden of illness potentially that we're looking at for a given project. So really it's again like adding in that context to the projects and thinking about where the population we're looking at is located, how they might interact with the healthcare system differently, again, for many reasons, and trying to understand what that means when we look at the output and we look at the results from the project. So when we interpret those things, it's sort of, you can't interpret what the data means without thinking about all those extra pieces. And just finally, like the part of the question relating to, the use of spiritual medicine or traditional food and other things like that, those aren't data that we have the best, information on at ICS, but things like that through partnerships with Chiefs of Ontario, they've collected some data on those types of things through the Regional Health Survey. So there's a lot of work that's been put into that. And those reports are available publicly on the Chiefs of Ontario website as well for some further information on how much people are using those things in the populations that they sampled for those surveys. So there's some information, some quantitative information that we can pull from and look at when we think about those types of things as well. So hopefully that answered your question.
Thanks, Graham. And just to add one last piece to what you said, we recognize our data and the research we can do is one piece of the puzzle. And that's why it's so well complemented with, community-driven work that's done within community. There's so much knowledge and data and research and different types of data that exist there. So this is why it really needs to be led by community and not by scientists at ICS or researchers like ourselves. I saw another question come in. So it says, do you link your data to health? Oh, sorry. No, that's the second one. Much of ICS's research is at the provincial level and does not aim to study Indigenous people specifically. However, based on existing published research, sometimes the cohorts we study are very likely to have important Indigenous community representation. Any guidance on when we should be consulting the Indigenous department about studies like these? Maybe I'll start with this one. So I think that's an excellent point. It's not just limited. Indigenous peoples are in all of our data sets. And just because there aren't identifiers in all the data doesn't mean that First Nations, Métis, and Inuit are not in those data sets. So one of the commitments we have with our partners is when we do know that there is an overrepresentation or a large proportion of Indigenous peoples in that data, that we do consult with them. Because just if we know, we should act on it. So I would say, I assume that the question came from a researcher. I think if you recognize and are aware that the cohort you're working with has a large proportion of First Nations, Métis, or Inuit, then I would reach out to the Indigenous department for consultation and guidance. We're here to support. So we're always happy to talk through it. And if it turns out that maybe there isn't a large proportion, then that's okay too. But we're always happy to provide information and to learn from others as well. And we have another question about linkage, which we will talk about shortly. So I will save that question. So the next section we'll talk about is, what data does ICS have? Next slide, please. So we've talked, we've touched on, I think all three of us, on the data or the types of data we have at ICS. So the way that we're able to hold this data is we have a special designation in the health legislation in Ontario, or Personal Health Information Protection Act. We're what's called a prescribed entity. And this allows us to collect information from various parts of the healthcare system without consent. And now, if you remember back earlier around the privacy piece, this is why the Information Privacy Commissioner reviews the way that we work very, very closely, because it is recognized that this is a privilege to be able to hold this data. So, and we of course want to ensure that privacy is protected of the individuals and communities that are within these data. We also hold, we are also, sorry, a prescribed entity under the Coroners Act, and are working towards our ability to receive broader data as well. So we have over 100 different data holdings that we are stewards for at ICS, and we often bucket them into these 5 separate categories. So the first is people and geography. So the backbone for all the data that we hold is based on health card numbers. So every individual that has been eligible for and has received a health card since 1985 is included in our data. And we also have information about demographics like age, gender. We have some death data, including fact of death, cause of death, and some information through death reviews at the coroner's office. And then we also hold other specific data sets like the immigration data. We, on behalf of First Nations, hold a copy of the Indian Register, and on behalf of the Métis Nation of Ontario, we hold a copy of the Métis Citizenship Registry. Now, these 2 data sets have very strong governance and oversight to their access and use. Now, the next column is really, this term is always used, bread and butter of what we do, and that's health service visits. So we have information on essentially every time someone touches a healthcare system in Ontario that is covered by the provincial system. So to Graham's point earlier, we don't have information related to federally funded services, just the Ontario provincially funded services. So things like physician claims, hospitalizations, when you go into the emergency department, some drug claim data when it's publicly funded, home care, rehab claims, and long-term care. So almost anytime someone interacts, there's a record of it with very rich, detailed information, and we're able to use that. Now, the next column is kind of the flip side. So we talked about the patients and the individuals as they interact with the healthcare system, but we also have information at the provider level. So this is about the system itself. So this would be facilities, information about where hospitals are located, the types of beds they have, physicians, some of their training, where they're located, information about home care, complex care, and long-term care. So this column in particular is very helpful to at least have a piece of understanding access or challenges to access to healthcare in Ontario. Now, the next column is disease registries. So this is it's a combination of some data sets that we've received from data partners like the Ontario Cancer Registry, but it's also other data like the Diabetes Registry that's been able to be created using all the other data that we have. So we've done some studies where based on the number of times you interact with the healthcare system in a certain pattern, there's a high likelihood that you have diabetes, for example. So using that, we're able to then study that condition or individuals with that condition. And then the last column is the one that we're, I think, continuing to work through, recognizing that the social determinants of health are so critical to healthcare outcomes for individuals and populations. So this is an area that we are focused on. We currently have information, some information, I should say, on the environment, transportation, social assistance, and some education data and disability support. This is quite limited in our ability to use it at this point, but it is something that we're working on. Now, one of the unique things about ICS is you see the keys across these columns is that we're able to, through record linkage, connect these data sets so we can track an individual as they interact with each of these different data holdings. So we can study lots of different healthcare questions. And so there was a question, do you link data to health card numbers or probabilistic linking? And if you do this, how do you link your data to First Nations health card numbers? So I'll just say the kind of the backbone I mentioned earlier for the data that we have, we receive from the Ministry of Health. So as I said, everyone that's been eligible and has received a health card number. So we get their health card number, their first name, last name, date of birth, gender, and some other information. And so, for example, the question was about First Nations data, where we have a copy, again, on behalf of First Nations, governed fully by First Nations, the Indian Register System, so the IRS. Then using the first name, last name, and some of the address information, we're able to probabilistically link those individuals to determine with the high probability that they're the same individual. I'll go through that in a moment, but just wanted to address that question. Next slide, please. I'll turn it over to Graham.
Thanks, Sajitha. So that's a great start for thinking about the data that we have at ICS. So I'm going to go a step lower down the chain and think about how we identify Indigenous people within those broad data sets. So there's a few different ways that we do that we've listed out here. One is self-identifiers. So there are some data sets at ICS that have variables where people have been able to self-identify as being, Indigenous more broadly, or sometimes more specifically First Nations, Inuit, or Métis. So those things do exist. We also often use geographic identifiers, and this relates mostly to First Nations data and mostly to First Nations people living within communities. But there are certain postal codes, residence codes, or even census subdivisions, which are all sort of geographic levels of identification that overlap with First Nations communities. So we can use that geographic information to see where people are living and whether that is within a First Nations community or not. The next column is registries. So Sajitha just touched on the first one there, the Indian Register System, which is something that, again, we hold through data governance agreements and data sharing agreements, and projects that use that have permission or are working with the communities that are looking to access the data for their populations within that database and link that to the broader ICS databases. So that's something that gets used a lot in those scenarios. And the other one in the registries is the Métis Citizenship Registry, which we sort of link in the same way. And then finally, there are some Indigenous specific data sets that are held at ICS. So those could be survey data where the participants were Indigenous. And there's also data from Indigenous healthcare providers. So things like Aboriginal Health Access Centers. And we've used those data in conjunction with the partners that run those centers as well. So as you can see, there's a few different ways to identify the population, and we can use those different ways in conjunction with our partners and sort of what their preferences and what their thinking is to best identify the people that they serve. So I believe I'm passing it back to Sajitha to talk a bit more about how we do that linkage.
And we have a couple of questions. So maybe I'll answer the first part and I'll turn it to you, Graham, for the second part. So the question relates to whether we're considering bridging the gap and accessing federal data using the IRS and NIHB. And so I will say we have been supporting some of our First Nations partners with engagement with the federal government around getting a copy of the NIHB data to support some of their work. Again, would be under very strict governance and First Nations governance. So yes to that piece. And then the second half is, are we also considering supporting the nations provincially to fill out their data sets more accurately? Some provinces are using NIHB in partnership with nations.
Yeah, I think that's a really good question. Like, the more information we have from those different sort of types of data, the more complete picture we have. When we're working with a specific partner, like, we get a lot of, again, like I mentioned before, a lot of the context about the health service delivery within their communities from those partnerships. So it's difficult to fill in the gaps, on the data side. in that same way without access to those federally funded data sets that Sujitha mentioned that sort of we're working towards with our partners. But what we can sort of do currently is more on the context side of knowing, where people are getting services, what's missing, and sort of building that into how we interpret the data that we do have.
And maybe I'll ask a follow-up, Graham, because I know you often work very closely with communities. Is there ever a request for support in like how data are entered, or building some of that infrastructure for data collection within communities?
Yeah, I would say we haven't done a lot of work sort of in that space, but I think we're here to support in the best ways that we can. So with what knowledge we have that can sort of help to fill those needs, we're certainly there to sort of help in that capacity. So yeah, I think that's an interesting point to think about.
And then we have another question. As far as self-identification, I would like to, if the option was given to list my nation, not the FNIM marker, that marker is imposed. Are you working to allow us to identify as our nation specifically? Maybe I'll start and then Graham also jump in, and Jess, if you'd like. So we don't often directly collect data. So we're what we always talk about being secondary users. So we're collecting data that have already been collected, usually in the healthcare system. And that said, I think the point around, it's a great point around that FNIM marker being imposed. And I think it's also getting it as much granulated as possible when we're looking at questions or data. So I think we've really tried to listen to our partners and not use a aggregated pan-Indigenous identifier, but instead use a little bit like use a distinction-based approach. That said, we do some projects with individual nations, but I would say, I don't know, Graham, do you want to comment on how you handle those projects?
Yeah, I think like you said, when we do work with individual nations, we can get a lot of information from them on, their preferences, how they would like to sort of define the population, what terminology they want to use to talk about the community or the population, um, things like that. But additionally, like I know in the data we have a lot of the information to identify, First Nations specifically comes from that Indian register system. In there, a lot of communities have, multiple names. Some have reverted back to using their traditional names. Some have the government imposed names that are part of the list. And I think there's been a lot of changes over the last few years, sort of in that respect, and sort of reclaiming names and using more traditional names. So I think that sort of goes a little bit hand in hand with, again, like thinking about the preferences of the partners that we're working with and working our best to name things properly and define things in the way that they think is most appropriate.
Thanks, Graham. So I'll speak very briefly. I know we only have a few minutes left and we want to make sure people have time for these fantastic questions that are coming in. So I'll speak very briefly about how data are linked, and it's really just a visual way of showing what we've talked about already. So we have the health administrative data and we have Indigenous data. These may be First Nations, Métis, or Inuit data that come in. So some form of data set that has an identifier for us to be able to know those individuals are Indigenous. If you could press the button once more, please. Thank you. So what we want to do is identify the person in the health administrative data that's the same person in this other data set. And so the way we do this is, I think we spoke about using a probabilistic linkage. We have more advanced ways of doing that, but essentially what we're trying to do is match if there's a health card number in both the files, which in, for example, the IRS, there isn't, we would just directly match that. But if there isn't, we would use names, date of birth, postal codes. Now, sometimes people's names are different in different data as well, which is why there's a probability that this is the same individual. And sometimes in the past, I know there's been line by line looking at some individuals to try to discern who that individual might be when you're trying to compare a few different people. Next slide, please. And this is just the same idea. You would continue to do that as you match the different individuals till you complete as much of the linkage as possible. And that's our last slide. So maybe we can open it up. If anyone has any comments or questions, we want to first thank you for your time and your attention. We really appreciate it. And if you have any questions at all, we will put in the chat our email address for our, oh, actually, could you go to the next slide, please? I think it's on this slide. There we go. So you have the 3 of our contact information. In addition, we have a generic inbox for the Indigenous department at ICS. So feel free to email there as well. And if you have any questions, we're open and listening. I don't know, Jess or Graham, while we're waiting, if you have any final comments or any thoughts you want to share, any jokes you want to tell.
I think
That's
maybe,
Graham's department.
there was a couple comments in the chat as we were
Oh.
talking. Maybe we can touch on that. Like one of them around training for staff around cultural competence and understanding some of these nuances that we're talking about when we deal with this type of data. We're certainly a non-Indigenous organization, but I think we've made a lot of strides in educating our staff, both within the team that's working on these projects, but also more broadly to the ICS community about these different types of things to consider. So we have a large number of staff that have undertaken, OCAP training and SANYAS cultural safety training, which touches on some of these things. But we've done some more broad events for the whole ICS community as well that have touched on a whole wide range of Indigenous focused topics, whether it be learning about history of Indigenous peoples or learning about cultural practices, things that are ongoing to this day. We have different sorts of events throughout the year that align with things like National Indigenous Peoples Day, and we have ongoing meetings called knowledge sharing circles that sometimes are cultural focused or data focused or things like that, but touching on sort of different topics that are changing how people think about this type of data and changing the way that we understand, that this data, we treat it differently. These are the reasons why we treat it differently, and really sort of sharing that type of knowledge and changing and thinking for the organization. So again, we're a non-Indigenous organization, but I think we really have made some strides in educating the staff in that way.
That's really helpful, Graham. And I will say, as much as we've done, we have lots more to do. We're on a journey, so we're nowhere near, I think, where we want to be, but we're all walking that path together and yeah, continuing our learning. And we also learn a lot from our partners who have been extremely generous in sharing knowledge with us and helping us to learn as well. So I think it's been such a great opportunity for all of us. There is another question that's come in. Is the Ministry of Health moving to establish a universal identifier? Will this include Indigenous individuals? And I would say probably that question, we can help connect you with folks at the Ministry of Health to answer that question. I'm not sure we're best positioned to respond to that. Any final questions? I know everyone's hungry. It's almost 12:30.
Gotta go get some pineapple pizza.
Or coffee, or both.
Okay, I think we're probably ready to wrap up today. So again, if you have any questions, please feel free to reach out to our contact information. Oh, sorry, my mouse switched. Contact information on the slides, but also this presentation will be recorded and available after 24 hours on the platform. So you'll be able to find our contact info there as well. And thank you so much for your time today. Thank you.
Thanks, everyone.
Have a good day.